Abdul from Hare Hills. How does it feel for me? November 2024. After your stroke, did you feel any gaps in your care? If so, what could have been better?
Well, after my stroke, I was in hospital for a while and I came home. It's only my wife and my wife became the carer after the rehabilitation at Chapel Allerton. I thought at the time that some kind of help would be given to my wife, like a carer and so on. But then back home, the strains were getting heavier and heavier, especially with my wife also retired like me. We were both struggling financially, and we inquired whether there are any benefits. And we were told that we both of us didn't qualify for only the state pension and the work pension. Sometimes I cannot go anywhere. She cannot go anywhere because she had to look after me. I would have thought that there'll be more help from local stroke help or local group, stroke group, or from the health people generally.
How is your current financial situation impacting your health?
My body started getting very cold. My left foot got swollen, and I have had problems moving around. And this has been a big problem because my wife cannot be carrying me around all the time. With the local health watch and the stroke group, they've advised me to explore other areas. So I've been referred to some places to find out what carers group can do for us. Health Watch has been very, very useful in advising me about what to do. There was this winter fuel that used to be paid, and that has stopped for both me and my wife. So my wife worked with the NHS, I worked for the council, but even the work pension is not much. If we had the means of buying gas and electricity on a regular basis, probably that would have made things different.
Can you share your experience with your cancer treatment?
After I was diagnosed, it was very scary. I was prescribed some medicine. They gave me this list of numbers and the people that I should call if there's anything. Now, because of this gap between now and on December, I thought I should be taking something else. And that gap has worried me because I thought the treatment should be continuous. I do have a lot of tablets that I was given after the stroke, which I'm still taking, like metformin and Keppra for the diabetes. I've been trying to call, but it's not been easy to get hold of anybody. Normally, I should have a text message to tell me what to do and when to go, but that has not happened for a while now. That's why I'm worried. I'm going to make an appointment to go and see the GP. It's always easier to go in by 8 o'clock and make an appointment, but normally they don't see you that same day. It's because when you call in to the reception, sometimes you are told to wait, and they say we'll call you after this time, and sometimes they don't. You have to go in and talk to them before you can be given even the normal prescription. So that has been the problem. Because with me now in my state, it's not always easy to go into the surgery because I have to take a bus.
If you could have changed one thing to make your experience better this month, what would it be?
I have a list that I'm given whenever I collect my prescriptions. That list of tablets and things that I'm supposed to take, I have to come in to the surgery and tick them off before they are issued to the chemist. If it's not done, then I can't get the prescription, and that again is a bit of a strain. If it was possible for these prescriptions to be issued every month, that would help a lot. And then if there is a way of being delivered because that has been my problem. Having to get up early in the morning, take a 9:30 bus to go to the chemist. But if that could change, that would make things easier for me, because the number of tablets I'm taking, if I get a clear idea of what is really essential and necessary for me to take in terms of medicines and tablets, I think that will help a lot.
What one thing about your care did you really value this month?
I really do value the care and the information that I'm given by health professionals. The last time I was there, I met a nurse who works there, who was very understanding and wanted to know what my situation was. And that was very interesting, because this person was really trying to know what was happening to patients. And this was something that I really admired. And this has happened in a lot of the times that I've been in either in hospital or in the rehabilitation center. The help that I've had from LGI, St. James's Urology Department, and then the Northeast Medical Center, and my local surgery have always been very helpful. I wonder what would have happened if I had not met these people.
Thank you to Abdul for sharing his experiences. Produced by HealthWatch Leeds in collaboration with Ro Lara.